Welcome back to part 2 of your narrated PowerPoint. We're going to pick up where we left off in the part 1 PowerPoint and start with what is normal in the maxillary palate. I noticed just sitting here looking at the PowerPoint, maxillary is misspelled, so you be sure and spell it correctly. So looking at this normal maxillary palate, let's look at some of the oral pathology in that. First, we want to look, obviously, we have some maxillary teeth. We have an incisive foramen right here. The nasopalatine nerve will travel through that. On each side, we have the rugae, and the raphe is in the center. If you'll notice, there's a little bit of color discoloration in it. That's okay, that's normal. And this is the maxillary tuberosity. If you'll notice this large bony area here, maxillary tuberosity on each side. So that is what we would consider a normal maxillary palate. Okay, looking at this slide, you will notice that the title is hard palate. There's two sections to the palate, the hard palate and the soft palate. We learned that way back in the fall in oral facial anatomy. So if you look at the hard palate is this area. It's the area that the rugae, the raphe, is in up to the centrals. Then if you come back toward the throat, even past the first molar into the second molar area, you would see the soft palate, which will be back in here. Okay, so you have the hard palate in the anterior and the soft palate in the posterior. The soft palate is what will make people gag if you touch it with materials or like your HVE. Okay, all right, now here we have another normal for some people. This is a palate with a torus. So if you look at the palate, you will see that we have the hard palate, we have the same anatomy we've already talked about. We have the teeth, and then in the center here, instead of having a flat area, let me scroll back, as this is deep here into the palate, here we have a torus. You will notice this looks like a lump, okay? This is not abnormal, but yet everyone does not have it. It's called a torus when it's in the palate like this. So that is an overgrowth of bone. We'll talk about the terminology again in just a minute, but that's an overgrowth of bone. Some people have it, some people do not. Now, the things that you have to consider when you have a patient like this is maybe placing a sensor in their mouth. Can't place it in the center. So if you were taking x-rays of the maxillary right, you'll place the sensor on the left. If you're taking for the left side, you place the sensor on the right. Think about taking an impression with an impression tray. This is going to rock. Your tray will rock on this. So you're going to have to get a tray that is cut out in the palate or built up. So you have to do some things to accommodate a person that has this palate with a torus in it. Okay. So here's something that you're familiar with. This is the buccal mucosa. Obviously, this is inside of the cheek. There is a line here that's very interesting. It's called the linea alba. It's a white line that goes through the cheeks. Some people have a habit of chewing on the inside of their cheek, and typically this is the area that they're chewing on, which can make it very thick and callous. So that's called the linea alba. It is normal. Just another picture of the buccal mucosa. Just a little closer up. It's kind of like a little fatty pad in the cheek. Now, let's talk about exotosis and tori. Now, we just talked about the torus, which is the projection. That's a singular word. So, exotosis is a benign bony growth. Now, benign means it is non-cancerous. It's just an overgrowth of bone. There's nothing to be concerned about. Some people may find these in their mouth and they get very excited and very concerned and worried they think maybe it's like a lump, but it's actually bone. Okay, so it's a benign bony growth projecting outward from the facial and the lingual surfaces of the mandibular or the maxilla. So it always comes outward from the facial and the lingual surfaces. Okay, exotosis is on the hard palate. It may be referred to as a torus. That's what the picture we just looked at. So a torus is a bulging projection, so an overgrowth of benign bone projecting outward. The plural is tori, so we'll talk about that in just a minute. So here's some letters that we talked about in our last video or recording. WNL, if you remember what that means, within normal limits. Okay, so these are not diseases. They are just extra bony projections. So a torus or a tori is within normal limits. It's normal to some people, does not mean everyone has it. Okay. All right, let's move to the bilateral mandibular tori. Now here we're using the word tori because it's on each side and it is bilateral. This is probably a little extreme. You're not going to see this very often. A lot of times you just see just a small singular one on each side, but we tried to show you a little bit of an advanced type tori. So if you look here, this is starting the growth, the bone here, here, and here. So you have it on both sides, bilateral. Now, what is the complication here? First of all, it's going to make it difficult to clean the lingual of these molars. Okay, be a little difficult to clean the linguals of the anterior. So that's our first complication. The second complication would be how tight is this frenum, right? Then the third complication we would have, what if this person ever wanted to wear a mandibular denture or a mandibular partial? It could not sit on these bones, so those would have to be surgically removed. They can grow back. Okay, so this is just an example of a bilateral mandibular tori. Now we're going to jump back up to the palate just a minute. Now you'll notice this palate is very different than the first one we looked at. The first one was just a torus in the center of the palate. Here you have something called lobulated torus palentinus. All right, that just means it's lobulated. That means lobes. Okay, so here's a lobe, here, and here. Okay, so those are lobulated. Now torus, remember we talked about the word torus, and then you have palentinus. That means in the palate. So it's just another longer name for a description of this. Now, what would be the complications of this? Really nothing. As long as the patient has their teeth, and where it's located, you could still clean the lingual of the teeth. The problem would be if the patient ever wanted would ever need a denture or a maxillary partial. Again, this would be very difficult to work with. A denture would not sit on this. The other problem would be if we tried to take x-rays. Maybe an impression. That would be difficult. So think about the difficulties that this may cause the patient. They don't have to have it removed, but there's some types of dentistry that might make it difficult to perform that procedure. Okay, so here we have another palate with a torus. This is the same image that we looked at before. Okay, and again another mandibular tori. Again, this is extreme. This is not what we typically see. We typically see very small ones, but let's look at this one again. Let's think of the complications this would cause. This person actually has nowhere to put their tongue in the center. Okay, so here you have the big overgrowth of bone, 3 different growths here. Again, cleaning the lingual of the mandibular teeth would be impossible, and plus they're sort of crooked in here, so that's going to make it even more difficult. So these really need to be removed. Okay. All right, remember we talked about torus, tori, and exotosis. So this is a maxillary exotosis. If you remember, we said that exotosis will be on the facial or buccal like it is here on the posterior. So here you have an overgrowth of bone. Again, this is not a problem. The patient does not have to do anything, but it is going to make it more difficult to keep these buccal areas of these teeth clean. You could not put an impression tray up there because remember, it's bone with just mucosa over it. So you would scrape that bone and make it very, very sore. So we would have to adjust our impression tray to be able to do that. Okay, so let's be sure we understand the word maxillary exotosis. This is different, just a different terminology, but we need to use the correct terminology between tori, torus, and exotosis. Again, this is a mandibular buccal exotosis. You see it's coming from the buccal again. This is the area right here. Okay, so again, think about placing an impression tray. You couldn't place it on it. It's hard, and it would be difficult to clean these teeth. Person can live with it there, but it could make dentistry a little bit complicated. Okay, so let's look at some of the implications of tori we've already talked about. It will complicate the use of a removable partial denture or a complete denture. So it can't sit on top of these bony growths. Complicate orthodontic appliances with palatal coverage. So if you think about a palatal extender, even maybe a retainer, so you think those will not sit on top of those bony growths. So they would be a complicated situation there. It could be adjusted. The dentist could handle it, but it would make it more complicated. Sometimes surgical removal is the only way to accommodate these type things. And again, it's not a difficult surgery, but it makes the patient's mouth real sore. But remember, they can grow back. Okay. Sometimes the patient may experience irritation from food against these exotosis, and you must be very careful when you work in a patient's mouth with these because you can make them very, very sore. Okay. So here's a palatal torus with a partial prosthesis over it. So this person has a maxillary partial, and as you can see, the partial is in a horseshoe shape, which is okay. Usually it has something across the palate to hold the sides, but here they were not able to do that because they were trying to build around the palatal torus. Now, if you look down at the bottom of the slide, it'll say notice irritation. You see these areas on here? This is where the person has maybe hit this with a toothbrush, potato chip, something like that. So it can be very irritated and become very sore. Okay, so we're going to stop here and we're going to pick up in session 3 of the PowerPoint, and we will start there with oral diseases. So be sure you practice the terminology and you know the difference between the terminology that I've used on these slides.